we're gonna do the دي اللي هعمل فيها superficial. So I've injected so many women for you for your academy. Which one of them is this one? Okay. So this is how I do my markings. Like I said, I go for the upper third of the nasolabial fold and I inject deep to the piriform fossa. Corner of the eye, you go down, you touch the bone, and you want to lift this upwards. See? So I want to lift this part upwards. And this malar fat pad will also enhance the lower part of the tear trough area. See, I'm simulating it from the bony projection, and I'm feeling the upper and lower parts of the zygoma. I'm almost drawing it anatomically. شايفة من ده كده؟ أيوة أنت بتسجلي؟ ده باين ولا؟
لا لا لا.
أوكي. So this is the mid-pupillary line, and I always leave this part because when you look at people who have this area depressed inside, just like me, when I smile, it's raised upward. If I put filler into this area, there will be more bulging. We just an abnormal or awkward looking bulge in here. So I mark my mandible, and you should never inject your clients and make them leave with ice packs, with creams like arnica and so on. She should go out of your clinic, enjoy the rest of her day, celebrate, go outside, have lunch, whatever. Because you should be very delicate and you should be aware of your anatomy. So see, I made her clench her teeth, I felt the border of the masseter muscle, and I know where to stay away from. One centimeter up, 1 centimeter out, remember? And when you are going to inject in this area, when you stretch the skin, you can see small vessels. Try to avoid them, It's always better if you inject and the person is not bruised. So there's no bluish discoloration, there's no nothing, it's more comfortable that way. Okay, so I put my trocar inside. When you take it out very slowly, you don't want a lot of bleeding, so take it out very slowly and take your time. So I have marked where I need to be, what I need to lift. So now I'm stretching the skin first, just passing my cannula. Now, just as it passed the skin, what I start to do is I'm lifting all the tissues upwards so that I can pass easily until I touch bone. See, once I touch bone, periosteum is sensitive. So now I'm touching bone actually. Now look, I'm gliding it over bone very slowly, and it just moves very easily. And from the same axis, deep, you can penetrate the prezygomatic fascia, and I can be in the tear trough area. Now, as I'm injecting, I have my fingers here to feel the filler. I always go back to the bone. This is my reference point. So I'm back over bone. I'm gliding the cannula just very simply and easily over bone, and I'm injecting to lift this malar fat pad. Now, I know where the infraorbital nerve is, and I stay away from it.
Technique or small doses?
Don't ask me these questions, whatever you want.
Anything.
You want to lift this. I showed you so many techniques. I showed you linear threading, I showed you fanning, I showed you boluses. Whatever. What do you want to do? You want to lift and you want to volumize. Can you do this by fanning? Can you do it by multiple linear threading? Can you do it by boluses? Can you do it by a mixture, some bolus and some linear threading? It's like I tell you, you're cooking something, use salt and pepper, right? So do I put salt first or pepper first? You're gonna put the same, right? Doesn't matter which one. So you do a bolus or you do linear threading, whatever gives you the result you're looking for. What are you looking for? I'm looking to lift this and to volumize it. So I probably do a little bit of boluses over this area, and I do linear threading on this area. I can do multiple boluses here. I can do whatever. I can do fanning here, whatever.